Step 50, cycle review. After your IVF cycle, if your cycle is not successful, then you review your cycle with your fertility specialist. And that's very critical step because you need to analyze your IVF cycle. You need to summarize your IVF cycle outcome. Then you need to make a plan for the next step. When you analyze your IVF cycle, you really want to understand what are the factors which contributed towards your outcomes. IVF is not simple intervention, that's complex interventions, which means there's lots of factors determining one single outcome, whether you get pregnant or not. Generally, you divide factors into four big groups. One is factors related to female patient, factors related to male patient, factors related to your treatment, then random factors, which is just roll of chance, or we call it luck factor. Essentially, we will go step by step of your IVF journey and try and understand where these factors are arising from, and then so that you can summarize and plan to address those issues. First, when you're analyzing your IVF with your fertility specialist, you start from the baseline. Baseline means before you even started your IVF treatment cycle. Then you look at the biggest baseline factors which contribute towards your final outcome. Female factors like your age and egg reserve, male factors, your sperm parameters and your health, then previous IVF cycles, how many eggs you got, and the sperm quality, embryo development, and your outcomes. This gives your overall picture in terms of your prognosis in IVF cycle. Then you analyze first stimulation stage of your IVF. Here you analyze what drugs you used for stimulation, dose of the drugs, type of the drugs, then dose of the trigger, type of the trigger, and duration of your stimulation. And you analyze how your ovaries responded to stimulation. When you're analyzing step by step, you can categorize your response or your outcome into three categories. You had a good ovarian response, average ovarian response, or poor ovarian response. Next step is you again categorize your ovarian response, looking at on your ultrasound scan results and blood test estradiol levels and how many eggs you collected. Also, you check whether you had any difficulties during egg collection, whether both of your ovaries were accessible, if you had any pathology in the uterus like polyp, hydrosalpinx, uterine fibroids. Then you analyze your total number of eggs, how many eggs you got. That's by far one of the most important factors which will determine your success in IVF. How many total number of eggs you got, how many mature or how many immature eggs you got. That tells us if there's any issue with the maturation of your eggs, whether you need to change the drugs in the future cycles. Then you analyze sperm quantity, motility, and morphology, which will help us whether there was a sperm problem which affected embryo development. Then you analyze fertilization, whether you had a normal fertilization, which means more than 75% of mature eggs were fertilized. If not, why? Is it due to sperm or due to egg? Then you analyze embryo development. So that is an analysis of utilization rate. How many out of fertilized eggs become high-grade embryo? That's called utilization rate. That's very important, critical information for you, because approximately 30% of all fertilized eggs should become high-grade embryos. If you had a very high utilization rate, that's very reassuring, which means your egg quality was good, your sperm quality was good, and the treatment stimulation went very well. If you have very low utilization rate, then that means one of these three factors were not right, or by chance healthy sperm were fertilized by healthy eggs were fertilized by unhealthy sperm. Then you look at the embryo transfer, if you had an easy, straightforward embryo transfer, or if there was a difficulties in embryo transfer which may have impacted your implantation. So then you analyze the grade of the embryo. So if you had a high grade embryo transfer, then you can expect approximately 35% chance of pregnancy in average. Of course, depending on your age, it can be higher or lower. And if you had a poor grade, borderline grade embryo transfer, then you may have much lower chance of success. Then you should assume that probably success was failure of the IVF was linked to the embryo, not your uterus. Then blood test, your HCG levels. What was your HCG level? And your progesterone levels 10 days after the embryo transfer. and then ultrasound scan, to check if you're on your scan the fetal viability was right or not. These things will help you to analyze step by step, looking at all major individual factors to understand where the success or failure in IVF is coming from. And then you summarize the outcome. So your fertility specialist, after reviewing, will summarize. They summarize main points. For example, they can summarize your ovarian response was poor, or embryo development was poor, or sperm quality was poor, or egg quality was good. They do objective summarization of your IVF cycle that helps them to formulate the plan for the next IVF treatment. They will try and address issues they have faced during that cycle on the basis of their summary. Then they will make a plan for next step. Next plan for next step can be fresh IVF cycle. Then they need to do optimization of your next IVF cycle by maybe changing the regime for stimulation, changing the FSH drug type and drug dose, changing your trigger type and dose, and addressing implantation issues. For example, if you're diagnosed with endometrial polyp, adenomyosis, or severe endometriosis, they may want to address those problems first. If you have frozen embryos, then they need to prepare a plan for frozen embryo transfer. They will decide which protocol to use: natural, stimulated natural, or letrozole or HRT frozen cycle. If necessary, they will want to do investigation. For example, if one of your ovaries were not accessible because of endometriosis or adhesions, they may want to do a laparoscopy first. And if you have implantation issues due to adenomyosis or due to endometrial polyp, submucous fibroid, uterine septum, they may want to do hysteroscopy procedure or address those issues, or do MRI scan, for example, for adenomyosis. And also they will look at the big picture. So if they can't make sense of the outcome, if they think there is a significant health issue which may be negatively impacting your health, then they will address those issues. They check if you're on any certain medications, if you have got harmful, hazardous chemicals in your work environment, life environment. They will need to address those. Then they need to address lifestyle factors. Then they need to optimize your overall health. Then make a plan for the next step of IVF. Analysis and summarization of your IVF cycle is very important in terms of formulating more optimized treatment for the future of IVF. That's why this is a very critical step, and you should fully understand your IVF cycle, so that it will help you to move on to hopefully much successful cycle in the future.